Welcome, my name is Anna Reese. I am an ICU travel nurse and I was a CVCQ nurse as a new grad. This is what you need to focus on in your first month as a new grad ICU nurse or as you are transitioning to the ICU. The first thing that I will say is really helpful to do is to write a to-do list on the back of your report sheet for your 1 or maybe 2 patients. The to-do list is going to be hour by hour and then follow that list with a lot of structure. The first month of working in the ICU or the first couple of weeks is really about the team being able to see how you are able to keep up with the volume of tasks. You're not going to be given a patient who is incredibly critical, or you shouldn't have an incredibly critical patient. It's more about getting the groundwork laid so that you can get through the everyday tasks of being a nurse. The to-do list is going to keep you organized and on track. And I will go over this in my next video, which is going to be about report and the ICU. But on the back, you're going to make an hourly to-do list. 8 a.m. assessment and pain medication. 9 a.m. medication, get the patient up to the chair, and then education on those medications. 9:30 a.m. chart. 10 a.m. round. 11 a.m. walk. Noon medication. 1 p.m. transfer the patient. And then 5 p.m. send labs, stock, and get the patient back to bed and give a bath. Things like that are going to keep you on track and structured. What they really want to see from a new ICU nurse in your first week or 2 is the ability to intake a lot of information and then to put it into action and to be very thorough, clean, detail-oriented, and on time. There are some people who will fall behind in this first month because they can't do all of the charting and it takes a little bit longer to get accustomed to the taskiness, and they really just want to see you absorb in the first couple of weeks the mechanics of being a nurse. And the mechanics of being a nurse include passing medications, drawing labs, patient education, physical therapy and mobility, and charting. So making a to-do list is a great way to stay on top of that to keep you moving forward. The second thing I recommend that everyone do is when you come in the morning, first thing that you're going to do is look up your patient. So read the history and the history of presenting illness and the H&P, get all of their medical history written down, and then look at their labs, look at all of the ordered medications for the day, and then in your to-do list that goes hour by hour, write down all the medications and labs that you're going to give and draw. With all of those medications, before you give them, look up on Micromedics or Lexicomp what the medication does and what are the side effects and why you would give it. Some preceptors are going to be more on top of you than others in regards to indication and side effects of medication. I had one preceptor who wanted me to say an adverse reaction of every medication even when I was 5 months into orientation, and I was like, it's Miralax. But it's a really good habit to form as you are a new grad or a new nurse transitioning, is to look up all the medications that you're giving until you've got it memorized front and back. So write it down when you're going to give all the medications, and then look up every single one of those medications before you give it, and then have a conversation with your preceptor before you go past meds. I'm gonna go give calcium gluconate because their ICAL was 1.05. I'm gonna give magnesium because they all get it and their mag this morning was 1.8. I'm gonna give potassium because their K was 3.2. I'm gonna give baby aspirin because all cardiac patients get low dose aspirin and dual antiplatelet therapy. And so something like that, you have to have a conversation with your preceptor before you pass all of your meds. And then the next thing that you need to do is go home and then YouTube labs and why you would draw what lab and what everything means. Couple tips right now, because I wasn't really aware when I started nursing as a new grad. Purple top is the complete blood count. The blue top is for coags, so PT, INR, fibrinogen, all that stuff. The green top is for chemistry. And that might help you because I wasn't aware when I was a new grad. And I was like, CBC, BMP, what is all of that stuff? So look it all up and then picture why you're going to draw all of those for your patients. Where I was a new grad, the nurses drew all of their own labs, and it was a really helpful practice for me as I was becoming a nurse because it helped me to think big picture for my patient. So when I came in the morning, I would sit down, I'd write down what medications I was going to give, I would look any new meds up that I wasn't familiar with, and then I would order labs for my patient. And then that helped me to picture the big plan for them for the day. So in recap, the things to focus on in your first couple of weeks in the ICU are on knowing your medications and why you will give them, knowing your labs and why you will draw them, being on top of your tasks and documentation to not fall behind. And then the last thing I will add is that this is where you are setting the tone for your new grad or your orientation experience. Be really honest and very receptive to training and feedback from your preceptors, and try to establish rapport with your providers at this point, because from here you're going to be building an acuity, and you really want to set the tone as being humble and teachable as a new grad. And there's so much I don't know still, and there is so much that I didn't know when I was a new grad. It's really like drinking out of a fire hydrant, the amount of information that you are learning every day. So set the tone, be excited, stay humble, learn how to connect with the patients. But then yeah, the big things to focus on are medications, knowing why, labs, knowing why, and when you're going to order them, making yourself a to-do list and sticking with it, keeping on top of your documentation and tasks, creating a good tone, and then leaving a clean room. Always leave a clean room as an ICU nurse, and then that in and of itself will open a lot of doors for you. You'll do yourself a favor. Next video is going to be on ICU report, and please subscribe and follow me on TikTok and on Instagram. It's Reese's RN on TikTok, and it is Anna Reese's on Instagram. Follow along for more critical care, new grad orientation, travel nursing, lifestyle, and CVICU content.